kind enough to host with us. I'd like to thank Dr. Jitendra Kumar and Ankita from the side of BBC for hosting this webinar. Today's webinar will focus on the unique cross-country innovation ecosystem kind of a collaboration that we have worked upon and touch upon certain aspects where innovators can leverage this or at least kind of start thinking of how they can leverage this. Um, so I would like to kind of thank everyone for joining and would invite uh, Amrit Hinduja and Shubhang Vikas to give us an overview of the Innovation Center.
Thank you, Rahul. Both Shubhang and me co-lead the India-Sweden Healthcare Innovation Center, and it's really good to meet many of you this afternoon. The collaboration of healthcare between India and Sweden go back a long way. We recently celebrated 2019 as the Year of Health, commemorating 10 years of cooperation between the two countries. And as we stepped into the new decade, both India and Sweden were very proud to launch in December during the royal visit from Sweden to India, the India-Sweden Healthcare Innovation Center, which is, as Rahul said, a cross-country collaboration between the two countries, and with, on the Indian side, partners such as AIIMS Delhi and AIIMS Jodhpur as the core partners. And we have built this concept as part of both the G2G and B2B kind of relationship between the two countries, and under the India-Sweden Health MOU. The overall idea, when we look at our vision and mission, is very much aligned to India's vision and mission to health in the country, which is to create healthcare for all. And several initiatives already in India launched by Prime Minister Modi are towards in this direction. And we hope that this initiative that we have created can kind of help further add to the step in the same way. And therefore, we have created this with a very high vision of creating affordable and accessible healthcare. And by this, we mean affordability by taking healthcare to the both, not just the haves, but also the have-nots, but also being able to kind of enable healthcare to reach all geographies and all types of patients. And we hope to do this in a very open innovation system. Open innovation is very much the way Sweden has kind of succeeded in kind of rising to a star in innovation indexes around the world, and therefore we hope to build this ecosystem. So though we are called an India-Sweden Healthcare Innovation Center, what we are really creating here is an ecosystem and not just a center or a physical kind of centricity. With that, I hand over to my colleague Shubhang.
Thank you so much, Amrit, and good afternoon, everyone. Very happy to thank you, everyone, for whoever could join this particular call. As Amrit rightly mentioned, center is a misleading word. We are definitely trying to create something which is more of an ecosystem by bringing multiple different partners on this particular platform, right? So that this becomes a marketplace for ideation, development of innovative solution, and scale up for the vibrant startup ecosystem that we have here in India. And while we are talking about innovation in healthcare, and there are definitely some focused therapy areas, as all of us can imagine, which we'll discuss shortly. It is also equally important to understand the building blocks or the pillars of this innovation center that will kind of form the base, or those will be the areas which we intend to improve upon through using innovative solutions from startups like yourself, who may already be working on some of those solutions. So the very first one is protocols and processes, where we are talking about the patient life cycle from awareness, screening, diagnosis, treatment, follow-up, up to rehabilitation. Um, as we all know, healthcare delivery definitely is a challenge, and these protocols and processes form the bulwark of how healthcare is delivered to one and all, and how we can make these processes more efficient so that it eases the load or kind of reduces the anxiety on the patient side, but also how can we make it better so that the administration of these protocols and processes becomes easier and more effective and efficient for medical practitioners as well. Um, Second is technology. Uh, while technology is a huge enabler and a huge driver, how can we use technology to reimagine some of the protocols that we just spoke about, bring speed and bring access to healthcare solutions to everyone, the have-nots and the haves as well, like Amrit spoke. So technology in itself will not be the end game of any innovation of this center, but how would we use technology to reimagine uh, different components of healthcare delivery would be the focus as well. And absolutely, kind of one of the things I forgot to mention is point of care devices. How do we use technology to better the effectiveness and the efficacy of existing point of care devices, or how we can make new ones? Uh, Third is business model. Uh, Again, to reiterate the idea that we're talking about affordability and accessibility of healthcare system, right? So, are there solutions which will ease in the burden and cost of healthcare on the system itself and on the patients? More importantly, on the patients. Fourth is data. How can we use the copious amounts of data that is produced in this country and even beyond? And how do we use it? How do we process that data? And then how do we disseminate that data effectively to relevant stakeholders? Is also a huge challenge that we see across the country. And we'll be welcoming innovators who are working in this particular space. And the fifth pillar over here is probably it's not mentioned here, but it is equally important is the scaling aspect. It's all very good that we can develop innovative solutions, but then how do we make sure that the medical practitioners, the paramedics, and the other healthcare delivery personnel are actually skilled on how to kind of use those innovative solutions to kind of provide an impact in the healthcare delivery overall. So when we go from the challenges to an actual impact that we want to create, these are the 4 or 5 pillars that the Innovation Center would like to kind of concentrate on. Now, if we go to partners, to reiterate again what Amrit and I have been saying, that we're creating an ecosystem. Now, how do we create an ecosystem? Of course, we have uh, entrepreneurs and innovators such as yourself on this particular meeting. But we have tied up with some of the most important government ministries and agencies that are in the forefront of both innovation and healthcare. We are proud to count Ministry of Health and Family Welfare in India, the Ministry of Health and Social Affairs from Government of Sweden. Um, we had the good fortune of tying up with Invest India, Startup India, and Atal Innovation Mission. A lot of you would have heard during a time as an innovator. And very importantly, ICMR, the Indian Council of Medical Research, which are in the forefront of identifying the gaps in the healthcare system. Second layer, and a very important layer, is the academia and hospitals. We have tied up with AIMS New Delhi and AIMS Jodhpur, who are our strategic partners and our collaborators. And this entire concept has been jointly being developed with them. As it will be discussed a little later in the call today, we would also kind of let you know as to the kind of facilities that both these parties are providing to this particular center. And thirdly, last but not the least, our knowledge and technology partners who are bringing the subject matter expertise. So we're very proud to have tied up with AstraZeneca, who are bringing a lot of knowledge, a lot of subject matter expertise that they have gained, not just in India, but from beyond the world, and which would be extremely, extremely important as we look to scale up some of the solutions that you're developing. Now, with that, I would hand it back to you, Rahul, to go to the next part of the program.
Thanks, Shubhank. Thanks, Amrit, for sharing the exhaustiveness of the whole ecosystem of the India Sweden Healthcare Innovation Center. I would invite Dr. Jitendra Kumar from BBC to uh, talk a few words about the highlights of BBC, the success stories, and then more address a bit on the need for affordable and accessible healthcare.
Thank you, Rahul. Uh, I'm very thankful to you to provide me an opportunity to talk on this subject. And I'm also very glad to be partnering with the India-Sweden Innovation uh, Center because you have a very good network, and I think we can enrich more on this. And we also see that a lot of innovations that you have in your network can be incubated in our center. Therefore, I think there is a lot of complementarity, and I thank you again for inviting me to for arranging this workshop together with you. I'll start with some introduction to Bangalore Bioinnovation Center. As you know, Bangalore Bioinnovation Center is a joint initiative of Department of Biotechnology, Government of India, and Department of IT/BT and Science and Technology, Government of Karnataka. So the idea was that there should be a world-class center which can provide all the nurturing support to the startup community in Bangalore, because Bangalore is the hub. Although we had one center in C Camp, but that was more of a in the north cluster, and there was nothing in the south. And Bangalore is a dense cluster. We have a lot of startups. Most around 40% of the startups are in the healthcare is in Bangalore itself. Total startups. So it's a startup hub of the nation. And southern Bangalore, which has a lot of cluster like atmosphere environment. We have companies like Biocon, Novozymes that are big companies, and we have IT companies, we have electronics companies, and then this biotech park has come up. You must have seen our Honorable Chief Minister had done a Bhumi Pujan or inaugurated the biotech park where the big companies can come and set up their operations. Within this park, there are three different components within this biotech park, which we say Bangalore Helix Biotech Park. One is the academic area where Institute of Bioinformatics and Applied Biotechnology and Center for Human Genetics. These two institutions are already functioning. They have done a phenomenal work in academics, a lot of innovations. Center for Human Genetics, as you know, is one of its kind in the country. And even IBA, which is Institute of Bioinformatics and Applied Biotechnology, is one of its kind. In bioinformatics, is a leading institute. This academic institution is followed by Innovation Center, which is Bangalore Bioinnovation Center. And then there is a cluster of bigger companies which are about to come to our biotech park. So there are three different zones, as I said just now: the academic institutional zone, the innovation zone, and the industrial cluster. So all these three clusters, all these three zones are highly interdependent, meaning that the IPs, intellectual property rights, and the workhorse, the manpower, trained manpower, is supplied by the academic institutional area to these startups which are incubated at Bangalore Bioinnovation Center. Even the students take up entrepreneurship in this, academic institution, and then they are incubated at Bangalore Bioinnovation Center. So definitely there is a lot of complementarity, but intellectual property rights and collaborations can happen from any other academic institutions, like we have with Agriculture University, Institute of Horticulture Research, IISc, IIMB, etc. Also, the other cluster which is coming up, the bigger industrial cluster, where many big companies can come, will always act as a anchor space where bigger companies are there, and the smaller startup companies may feel confident about it. The whole ecosystem will develop because these bigger companies can act as a collaborator, funder, and even the partnership opportunities could exist. So I think this whole cluster is coming up in a big way in southern Bangalore, and Bangalore Bioinnovation Center is trying to crystallize this whole cluster. In Bangalore Bioinnovation Center, we have state-of-the-art equipment facility, which is supported by Department of Biotechnology, and BIRAC, which is Biotechnology Industry Research Assistance Council. And we have provide mentorship, funding, networking, branding, and all kind of nurturing support to our startups, so training programs, etc. So to make these startups, successful or at least venture ready, we have connections with lot of venture capital companies or funders, Indian Angel Network. So these startups are exposed to these venture funding and funding opportunities. So there is a whole ecosystem. All we need is to make more and more entrepreneurs aware of these opportunities and create more and more robust pipeline of entrepreneurs in life sciences. So Bangalore Bioinnovation Center is very hopeful that the collaboration with India-Sweden Innovation Center would be of great value, and the cooperation between these two centers would be very helpful in complementing the efforts of each other. Now, what is the necessity of this healthcare system? As I think Shubhang and both Amrit had spoken about what is the need for this, medical device diagnostics, pharma, biopharma. What is the need for, what is this so much urgency? The urgency arises from the factor that India is not up to the mark when it comes to the healthcare. The cost of healthcare has been very, very high, and majority of population is not able to meet the expenses of healthcare. The primary healthcare center, the government-run healthcare center, has not been up to the mark. So when it comes to the private healthcare, the people do not have money. They are not so much. They are not so much affluent or uh, able to meet the expenses of healthcare today. So why is it so? It is because most of the equipment facilities and whatever diagnostic devices, even pharma, biopharma, is if it is novel, I mean novel molecule, I'm talking about the novel molecule which is patented, and I'm talking about the equipment and medical devices and diagnostics are imported actually. So import is definitely one of the burdens for this healthcare, and our Prime Minister's clarion call for Atmanirbhar Bharat and indigenous development would be very, very effective in decreasing the cost of healthcare in India. Towards this effort, I think Bangalore Bioinnovation Center tries to lower down the entry barrier for these startups so that they can develop these products. Most of the products in medical diagnostics and devices sector aims to decrease the price, make it more affordable and accessible. For example, um, uh, telemedicine. Many companies in BBC and somewhere elsewhere are developing devices which can capture the data at the primary care center or at the patient's side, and then it can transfer the data to the hospitals for further analysis. There are companies who are developing artificial intelligence devices which can be overlaid to many data. For example, one of the company called Aindra, which is incubated at Bangalore Bioinnovation Center, has developed artificial intelligence tool which can be overlaid to the chest X-rays to detect COVID-19. They're in the process of commercializing it. Much validation has happened. There's a company called Cardiac Design, which has just launched Padma Vitals, one product, which can analyze the parameters, healthcare parameters like blood sugar, blood pressure, ECG, etc., at the bedside, patient site where the patient is, and even if he's in hospital, then doctors need not go there and because of in COVID time it is again a major problem. So the data can be transferred to the doctor and then they can be alerted what to do next. There is another company called Janitri which has developed a device called Daksh, which can do a remote monitoring of pregnancy. So doctor need not be there and they can. So all these innovations are very, very helpful in areas which are uh, resource constrained. And these may be affordable, if the volumes are high. So when we talk about accessible and uh, healthcare which is affordable, we take into account the cost of production, which is directly related to the economies of scale. We talk about the uh, the government policies of procurement, which can lead to the lowering of cost, and definitely insurance, which does not come into the technology sector. But of course, I think the insurance is very important for making the cost, the healthcare cost effective or affordable in India. As you know, most of the people in India are not covered by insurance. Therefore, I think these are some of the challenges and some of the opportunities that exist. I would end my this talk by saying that some of the innovations that are happening in India would find way to the Western countries also, because I know in US also the cost of healthcare is huge. Although it is covered through insurance, but definitely it's a huge burden to the economy. And they are also looking for innovations which can reduce the cost of healthcare. And I think the innovations that are developed in India, which is in under resource constrained environment, eventually could find ways in Western countries also. So we need not restrict ourselves, or our innovators need not restrict only to the Indian market. I think there's a huge market in European and Australia and US also. And to this effect, Bangalore Bioinnovation Center has been able to forge links with many countries, innovation clusters, especially Australia, Japan, US, uh, and Israel, where we can expose our startups to these clusters and understand their market and ultimately go global. So vocal for local and go global is something that we should think about. So with these few words, I would like to thank Rahul again and giving me this opportunity. If there are any questions, I would be very happy to answer. Thank you so much.
Thanks a lot, Dr. Jitendra. One of the things which you mentioned was the COVID, and I guess we all are kind of still reeling with the at the backdrop of how healthcare is being delivered, because not every department within hospitals are kind of open now. And who other than to talk about I invite Dr. Nikhil Kothari, who is from AIMS, to kind of talk a bit about the need for innovation at this juncture of the journey, and then also kind of highlight a bit more on the themes of the innovation challenge.
Okay, thank you, Rahul. So, good afternoon, everyone. So, it was a nice introduction and it was a very elaborate description by Dr. Jitendra regarding Bangalore Bioinnovation Center. So, it's really impressive to learn that the people are doing very good in different streams. So, this is a new organization which has come up. So, probably they may do well in future. So, I wish them good luck for the future success. So, as a part from academia, so two of the aims like Delhi aims and AIM Jodhpur are also the part of this innovation mission. So being from Jodhpur aims, so I was given a task to discuss the technology aspect. So if we consider the healthcare of our country. So the healthcare system is beset with several challenges, and the most worrisome challenge which we face these days is to provide an affordable healthcare. The healthcare which is affordable to the masses. So it's not very simple. So we need to have an out-of-box thinking. We need to have some different thinking, like how we can give them an affordable healthcare. And it really needs innovation and looking for new ideas. And if we see the search engine of our country, so now the search engine, the model of research in our country is moving towards innovation. We are not limited to just molecular research. We need progressing towards making India devices, biomedical devices, which can help lot many people. And this is so there are a pool of scientists and people from biomedical engineering who are into this task, and they are looking for several opportunities which would cover like fields like AI, artificial intelligence, Internet of Things, and telemedicine and different aspects. So telehealth and telemedicine. So these are a few digital platforms which really help us to connect to masses, and we can just sort their problems sitting at the tertiary care center. So they don't really need to travel, waste their whole day to seek medical advice. We can just sort them. So we need to develop more devices in these fields so that the people can be helped while they are in their places. And also, I would say that our country is confronted with host of daunting challenges. The few challenges which we face is first is lack of awareness, and then the malnutrition, and third is your enormous burden of disease. And all these things, if we say, they are linked with each other, because people are not aware. They're not aware that what will imply like keeping themselves healthy will give them a productive life. So they have such habits which don't follow the healthy lifestyle, and this leads to malnutrition. Either they are malnourished or obese. This adds to malnutrition, and further leads to the disease process or illness. And if we see the population of our country, like if you talk of 130 crore, a population of 130 crores, so this is an enormous burden of disease. Even if the disease affect only 1% of our population, like if you talk of the communicable disease, the pandemic which has been spread these days, so that is COVID illness. So if it affects only 1% of population, that would cover somewhere around 1.3 crore people in our country. And this is a huge number. So there's enormous burden of disease. As per stats available across the world, so across the world till date, there are 2.9 crore people who are affected from COVID. And if we talk of our country, one person means 1.3 crores. So that's a huge number. And besides communicable disease, we are also our country also grappling with certain non-communicable disease. So we have huge population which have disease like cardiovascular diseases, diabetes, hypertension, renal failure, cancer. So these are very much prevalent. And if we see the data, like if we see the data released by Indian Council of Medical Research, ICMR, so they have said in their registry that till 2020, by the end of 2020, there will be somewhere around 17 lakh people in our country who will be suffering from various cancers, and the amount of deaths which may be due to cancer may cross up to 9 lakh. So 9 lakh people in our country may die because of the cancers, and most common the cancers are breast cancer, lung cancer, cancers from liver disease. So we need to think of innovation in these aspects, like if we can use nanotechnology, if we use I would say if you use certain immune modulators, if you develop the devices which are dealing with nanotechnology, and by use of these devices, if we can hamper or we can just restrict the growth of or the multiplication of the cancer cell, so probably we can prevent the spread of disease in the body and can save not many lives. Apart from the cancer disease, another key area is sepsis. because sepsis is also taking lot many life, and it is a myriad of disease symptoms in which the person is having while the person is undergoing a sepsis. If we talk of ICUs, intensive care unit, when the people, the patients are admitted in intensive care unit, so they have the sepsis is affecting several organs, and the most needful thing for this today or to date is point of care devices. We need to develop the various point of care devices which we can diagnose the sepsis at an early stage. If we can look for certain point of care devices in which by mere drop of blood or by any of the body secretions, we can detect the ongoing changes which are occurring in the particular organ. So this would help in controlling of sepsis. So these are few areas in which we need a really innovative things to control the burden of disease in our country. So I would say, Rahul, so that was from the technology aspect, which need to be worked into so that we can provide an affordable healthcare solution to the masses of our country. Okay, so that's all from my
Absolutely.
side.
Absolutely. Thanks a lot, Dr. Nikhil. I
Thank
think
you.
the challenges that India faces is quite complex. However, we have tried to identify innovation challenge problem areas that we want to kind of specifically address, which has been chalked out by AIMS Delhi, AIMS Jodhpur, and all our other partners. I invite Deepak Arora and Jayashree Mahapuri to uh, elaborate a bit more on the problem statement and the kind of benefits that the innovators will have.
Yeah, thank you, Rahul. If I can have the slide, please, for the problem statements. Yeah, thank you. Okay, so my name is Jayashree Mapari and I'm from the market access team at AstraZeneca. I'm a co-team member of the India-Sweden Innovation Center project. And in the next few minutes, we'll be talking to you about the problem statements that we have outlined under the innovation challenge. Um, from a point of view of, I think, therapy area, as already alluded by the previous speakers, Dr. Nikhil and even Dr. Jitendra, the focus for the innovation challenge would be non-communicable diseases. As you are all aware, non-communicable diseases lay a significant burden on our healthcare system from a point of view of the chronicity of the ailments, the amount and the extent of support that is required for the patients to manage these conditions, over sustained periods of time. So it's a fairly resource intense, it's a fairly investment heavy kind of a disease area, which also has a lot of unmet needs and challenges from a point of view of the patients. So there's a significant amount of patients who are probably not aware of the condition. There are challenges in terms of timely diagnosis and screening of the patients. There are challenges in terms of the skill sets that are available with the healthcare system, healthcare providers, for being able to effectively treat these patients. So, and of course, there is a lot of hand holding, there's a lot of support mechanisms that would play a critical role as well. So, considering all of this, the core team members of the India Sweden Innovation Project have decided that for the problem statements, we would be focusing on non-communicable diseases. What I mean by those is chronic respiratory conditions like asthma and COPD would be what we would be looking for solutions from. Second area would be from oncology. So as Sir alluded, women cancers, for example, breast cancer, cervical cancer, ovarian cancer are the areas that we would look for in oncology. Lung cancer, prostate cancer are also significantly higher in India. And these were another area that we would look for solutions from under oncology segment. Coming to cardiovascular, it will be diseases or ailments like stroke, coronary artery disease, even risk factor like hypertension would be areas that we would look for solutions from a therapy area perspective. Chronic kidney disease, end-stage renal disease would be another area that we would want to focus on. And last but not the least is diabetes and the entire gamut of metabolic conditions associated. So diabetes, dyslipidemia, which is associated closely with diabetes, as well as complications that are ensuing from diabetes in terms of be it retinal, foot complications, etc. So in a nutshell, those would largely be the areas from a therapy area perspective that we would focus on from a problem statement standpoint. Now, looking at the life cycle of the disease, as I alluded to, there are significant unmet needs as far as the entire life cycle of chronic diseases is concerned, right from awareness right up to post-intervention support and management of patients. So we would like to look for solutions that aid us, help us, support, and improve efficiencies, let's say even in education awareness of patients, or for that matter, any kind of devices that help us, timely diagnosis of some of these conditions, or for that matter, enabling better management of patients, both pre-intervention, post-intervention standpoint. So that would mean possibly covering the entire continuum of care as far as chronic diseases is concerned. Then coming to the end user or the target segment in mind, right? So when we are looking at solutions, we would like to look at solutions that enable or empower the patients. We would like to look at caregiver empowerment as well. We would like to look at things that support or make it easy for our physicians, for our healthcare workers to operate within the current environment. So solutions that are targeted towards them as end users would be also looked at or explored, as well as the overall healthcare system delivery per se. So that's the spectrum that we will be looking at from the end user perspective. Coming to the kind of solutions, so sir, I already mentioned about technology. In a COVID scenario, in the current pandemic situation, I think it's increasingly important that we are able to operate effectively but remotely. Yeah, so there is not that much of face-to-face interaction that may happen, and in that sort of a scenario, I think anything that enables us to operate effectively in a remote environment is that much more required. So we will be looking at solutions that are digitally enabled, solutions that are M-based, tele-based, you think of it, and we would be more than happy to look at those kind of solutions. Last but not the least, I think, is the fact that innovation has to be relevant. So when we talk of relevance, I think it has to fit the market conditions. India is a huge country. Our population is diverse. We have a lot of patients, a lot of people residing in rural areas, remote areas where access, affordability are challenges which we need to be conscious of when we are developing the solutions. So while we may have the best of solutions, they need to operate effectively even in resource constrained environments. So it needs to be frugal, it needs to be relevant to the market conditions. Second, it has to be reliable. So, from a sensitivity, specificity, it needs to have enough and more data and evidence to back the solution for us to have the confidence of using this and embedding it into the healthcare delivery mechanism. Third, it has to be scalable. Whatever is a prototype alone at a in principle basis may not work. We'll have to be able to, if it's something good enough, we should be able to scale it and apply it so that we are able to benefit the masses at the earliest that we can. So these will be some of the three key considerations that we will have. Last but not the least, we cannot do away from science, we cannot do away from evidence. So we will also have a focus on evidence and outcomes based solutions. What we mean by that is we would like to measure whatever it is that we are doing. We would like to look at solutions that allow us to effectively capture data, allow us to dabble into real world evidence. At the same time, any solutions that look at mining data, enable us to create predictive algorithms or decision analytics, etc., on the basis of the data that's available. And when I say data, it's not just records, it's also in terms of maybe pathological reports, or for that matter, radiology reports of patients, etc. So any tools and solutions that enable us to effectively use these data points would be what we would be looking at. Giving you some of the examples, I think, which would possibly help you. So for example, in the case of oncology, we would look at solutions that allow us to use, again, as I said, pattern recognition, artificial intelligence to maybe allow us to do tumor differentiations, or allow us to screen patients from a risk profiling standpoint and catch them early, yeah, so that they are coming into the referral pathway. There is timely diagnosis of these patients and they are able to access care in a timely fashion. A lot of times patients within the oncology domain do not realize the symptoms. They do not get screened at the right time, and as a consequence, report when the disease is fairly advanced. So with the help of the innovation challenge, we want to see how many patients and effectively pull those patients into the referral pathway at the earliest that we can. So that's one example that I can quote of. The second thing would be in the area of something like, for example, cardiovascular conditions, that patients recovering from ACS, or for that matter, a stroke. There is a lot of hand holding of the patient post intervention, post hospitalization, which the doctors should be effectively able to do through remote monitoring. So those would be some of the solutions that we would look at. So in a nutshell, I think you've got the gist of the kind of solutions that we are looking for, and would be happy to basically answer any queries that you have, and also urge you to, at the end of the presentation, we will be flashing our website. Please go to the website. There is a detailed description of the entire problem statements under the innovation challenge. And if there are queries, you can come back to us always. But that's it from my side, from the problem statement standpoint.
Thanks, Jayashree. We will move on to the benefits. I won't take much time. I think it's pretty very much alluded by Dr. Jitendra as well as Dr. Nikhil in terms of this whole link of challenge opportunities and how innovation can really help. What we can provide on this platform is about the mentorship, and I think it's very important we look at the renowned industry leaders and faculty which can help and work with you shoulder to shoulder in terms of making sure that the problem statement and the solution are working very cohesively in making out the right solution for the right targeted customer, which is basically in patients or maybe in terms of the disease state. Funding is important. While we have an idea, it's important. While we have a mentor, it's important to have a right funding behind that solution. So we will be providing an array of funding in terms of the investors which will be looking forward for. So your pitch should be very much right, and too connected in terms of picking up that kind of an investor looking at that solution. Solution showcase, I think it's also very important in terms of how do we scale it up, how do we make it forward in terms of let the world knowing about what kind of solution we are working upon, and that will work very closely with the incubation. And I think we thank AIMS Jodhpur for providing us that facility, the seeding in terms of taking that solution, working on that solution in that incubation center, because it's very important that what the idea is, how we create the solution, but we can also seed in the real world setting to make sure that this is creating some evidence based on that ideation which was coming. And that's the reason you will not find better than AIMS providing you a kind of an incubation center or facility to seed that solution or see that idea into the real world evidence. This whole forum, while we start looking at mentoring, solution showcasing, or incubation, will also give us a kind of networking, which will give an opportunity with policymakers, health experts, and industries, which will pick up these solutions and scale it up in terms of where the challenges lie and how do we pick up those and maximize on those opportunities which we will be developing based on your ideation and based on your innovation. Last but not the least, I think India-Sweden Innovation Center or the complete platform gives us a perspective, gives us an opportunity to scale it to global level. So on all these aspects, we look forward for your pitch, we look forward for your participation, because we have a problem which your ideation can link it with. We have mentors, we have all the right partnership from institution perspective, from government policy makers, and we have a right place where we can seed the solution to see the real world evidence coming out of it. And once that is done, there's a great networking, solution showcasing, and global outreach which will follow. Thank you so much. My name is Deepak Arora. I am the Market Access Director and also Commercial Excellence Director. We look forward from an AstraZeneca perspective and our partners NASCOM perspective to take this to a newer heights with this challenge. Thank you.
Thank you, Deepak, and thank you, Jayashree, for giving a very elaborate understanding on the problem statement and the huge benefits that are there. So from a timeline perspective, I would say that we are open with the application, which started on 11th August. I would suggest that you apply before the 27th of September, which is close to a month now. There will be winners will be announced on 25th of October. And in between that, the 1 month period will be the time that we will take to kind of have multiple round of discussions or evaluation process that will be there. Yeah. So if you have any further queries, questions, we can take it up. You can put it in the chat, or if there are any other questions, I'll share my mobile number and email ID. We can go to next. So yeah, we have put up our website where you can go and check out a bit more details. All the details are there. If you don't find any detail there, you can write an email to me at the specific email ID. And my mobile number is there where you can call me and have a word with me. And look forward to receiving the application before 27th of September. If there are any questions, do let me know. Otherwise, you can reach out to me whenever you feel it's convenient. So thank you all for joining the webinar. I'll be disconnecting the webinar.
Okay. Thank you. Thank you, everyone.
Thank you.
Thank you, everyone. Thank you.
Thank you, Rahul.
Okay. Thank you. Thank you,
Thank you,
Shubham.
Mr. Jitendra. Thank you.
Thank you, Nikhil, Dr. Nikhil. Thank you, Dr. Jitendra.
Yeah, thanks, Jayashree. Thanks, Deepak.
Thank you, Dr. Nikhil.
Thank you, Deepak.
Thank you, everyone. Bye-bye.
Thank you, Jayashree.
Bye, everyone.
Thank you, everyone. Thank you, everyone.